Good afternoon. My name is Ismail El-Hamamsy. I'm the Director of Aortic Surgery at Mount Sinai Hospital in New York City. I would like to thank Dr. Milowicz and Uzunian for the invitation and the privilege of participating today in this Aortic Awareness Day. And the topic I was proposed to talk about was aortic dissection risk with the COVID-19 pandemic. As you all know, New York City got hit very badly. It all started on March 1st with the first reported case of COVID. Followed by that, a state of emergency was declared in the state of New York on March 7th. That was followed by March 15th, school closures in all of New York City, which is a very large school district. And then finally on March 22nd, a total statewide lockdown. But more importantly, as of the beginning of March, what we really felt in New York City was a state of panic, a sense of doom, and a lot of uncertainty in the face of the unknown, because nobody really understood COVID. Nobody really knew what the consequences could be. And there was a lot of fear. We were seeing the numbers of admissions increase in the hospital. At the highest point in the COVID pandemic, in our health system at Mount Sinai, we had over 2,200 patients admitted in our beds with a COVID diagnosis, many of whom were on ventilators, sometimes two on a single ventilator. So there was certainly a lot of panic in the air, and a lot less was known than we do today, only 6 months later. But importantly, what that led to was, in terms of real-life observations, from a cardiology standpoint, we were hearing our colleagues in the cath lab tell us that they were seeing less and less patients present with acute myocardial infarction requiring stent placement, etc. And at the same time, we were reading reports from the FDNY data showing a 5 to 10 times increase in the number of people dying at home. It went from around 25 deaths at home in New York City per day to around 150 to 250 deaths at home per day, many of which remained unexplained, of course, but presumably a large number of which were perhaps due to COVID itself. But the question really arose, could some of these deaths be due to other reasons than simply COVID infections? And so one of the questions was, what about aortic dissections? We know that acute aortic dissections are immediately life-threatening conditions, and the only treatment for an acute, at least type A dissection, is surgical intervention. And therefore, perhaps some of these dissections were happening at home, or perhaps the patients were not presenting to the hospitals. So together with the colleagues from around all of New York City, all the hospital systems at Cornell, NYU, Columbia, Mount Sinai, Lenox Hill, and other hospitals around the city, all of the main aortic surgeons, we got together and analyzed our data in terms of volumes of acute type A aortic dissections that we were seeing during the pandemic, during the months of March and April, to try to understand what the impact of the COVID pandemic was on acute aortic dissections. And we published these results in the Journal of the American College of Cardiology. And importantly, we call that a matter of public health. And I will show you why. These are data of volumes of surgically treated acute type A dissections in New York City in the first 4 months of every year from 2018 through 2020. And what I want you to focus on are the red lines, which are January, February, March, and April of 2020. You can see there's a rapid and precipitous decline in the number of acute dissections in March and April. And importantly, these were much, much lower numbers than we saw in the 2 previous years. If we average the number of acute aortic dissections that are treated surgically in New York City in all the hospitals combined per month during the 2 years prior to COVID, or prior to March 1st, or the first reported case of COVID in New York City, it was around 13 dissections per month, and it went all the way down to about 3 dissections per month during the height of the COVID pandemic. To illustrate it differently, in blue is a curve with each month of the volumes of total volumes of surgically treated dissections. You see the numbers hover anywhere between 10 to 20. And then as the COVID pandemic hit, the numbers really dwindled and almost disappeared. At the same time, what you see here in red are the number of COVID infections in New York City. Remember, at the height of the pandemic, New York City had the highest number of COVID patients of any country in the world. We have been very, very good since then, and the positivity rate has been extremely low. But during March and April, things were pretty ominous here. Now, how come that decline in acute dissections was observed? Well, one possibility would be that perhaps with the lockdown, people were being less active, they were staying at home, there was less stress, they were straining less, and there were less dissections occurring. That may be possible, but biologically, this may not be very plausible. In other words, there may be other explanations. And this is what we thought was more the case, or the reasons why we were seeing less dissections. I think there was a lot of fear from the part of the population of visiting emergency departments at the height of the pandemic early on for fear of contracting COVID. I think our EMS services were also very overwhelmed, which resulted in long delays in response. And we know that with every hour that goes by after an acute type A dissection, the risk of mortality increases. And anytime an event like this happens, patients have to present ASAP to the emergency department, and the diagnostic delay has to be pretty short as well if we hope to have good outcomes. I think there were also a lot of possibly missed diagnosis in the emergency departments. Again, at that time, every emergency room doctor was focused on ruling out COVID in every patient that presented. All the patients were just pouring into the emergency departments with the same complaints of difficulty breathing or a bit of fever and sometimes chest pain. And I think some of the dissection chest pain may have been diluted in the masses of COVID patients. And if the patient didn't have typical symptoms, perhaps they were just sent home, and that may have contributed as well. And finally, there may have been a bit of a less liberal use of CT scan imaging for fear of contaminating patients who were not deemed at high risk of having COVID, because the CT scan machines were really mainly used to look at the lungs of patients that either had confirmed COVID or had suspected COVID infections. And so we were afraid of sending patients that we thought did not have COVID to avoid contaminating them. These may be some of the reasons why we saw these dwindling numbers in acute type A dissections. So the lessons we've learned since then are that things do not stop because of COVID. And I put things between brackets because by that I mean acute heart attacks or acute dissections or everything else continues despite COVID. And so we have to be well aware of that. It is really important to consult anytime you're feeling acute or unusual symptoms. One should not just stay home because there's a rise in the number of COVID infections that is ongoing in wherever you may be living. But importantly, as patients, particularly as patients who are at risk of aortic events, it is really important to take extra precautions to prevent catching COVID, because this can actually complicate any surgical intervention in the event that one would show up to the hospital with an acute dissection. If there's a suspicion or confirmation of COVID infection, this really makes it a lot more difficult for the surgical teams, and it can cause undue delays to the surgical repair. That being said, from a positive standpoint, I think we've come a long way since the initial pandemic in New York City. I think the observations that I reported here are probably not replicated in many of the other cities today, because we've learned more about what COVID is. I think there's a little less fear. We've learned how to keep our distances and to be careful in our day-to-day. But still, I think it's important, especially as potential second waves are starting to arise, it's important to remind ourselves that it is important to consult anytime one has any issues. Some of the outstanding questions with regards to acute dissections and COVID-19 are, is there a link between COVID and aortic disease or a link between COVID and acute aortic syndromes? We don't have a direct answer to that question, I invite you all to participate in this survey, which is driven by Dr. Shalom from Seattle. I think this will be very important in informing our knowledge about aortic dissections and COVID. And finally, my personal advice to you is A, stay vigilant, do not drop your guards, follow the CDC guidelines, wear masks, wash your hands, keep your distance. All of these are really important things. It keeps you at bay of having a COVID infection or any such thing, which is really unwanted in the context of being at risk of aortic events. And finally, listen to yourself. If you're feeling, again, any funny symptoms or anything unusual, do not hesitate to talk to your doctor or to head to an emergency department to have it seen. So with that, again, I would like to thank the organizers for the invitation, and I look forward to the discussion.